Good afternoon, ladies and gentlemen. Welcome to another episode of Myth Busting, Myth Cracking. Today we'll be looking at the myths surrounding sexually transmitted infections, sexually transmitted diseases, and we're going to demystify these myths and give you information that will be relevant for your protection. Now, what is sexually transmitted infections? They are infections that are gotten from sex, the unprotected sex, such as oral sex, anal sex, or even through vaginal penetrative sex. We have eight common sexually transmitted infections, and it is known that about 1 million persons are being infected every day worldwide with sexually transmitted infections, and about 376 women are actually living with gonorrhea, and about 500 million persons are currently living with herpes virus all over the world. And you can then you ask yourself, then why are we so shy about talking about sexually transmitted infections? Because we are all holy, and we are all close to God. We are perfect, and as such, nobody agrees that they are having unprotected sex. But from statistics, it has shown that most persons are actually sexually active, but they try to downplay it, so hence they get infected with these deadly sexually transmitted infections. Now, we have different sexually transmitted infections. We have bacterial infections, we have viral infections, and we have parasites. For example, the bacterial infections, the most common are the gonorrhea, the chlamydia, and the syphilis. These are the most common sexually transmitted infections. Though we have the Haemophilus ducreyi, though not so common. We have the mollusca contagiosa, not so common still. But the most common ones that are causing problems to people today is the gonorrhea, the chlamydia, syphilis, herpes, simplex virus, hepatitis B viruses, hepatitis B, hepatitis C viruses, HIV. These are the infections that are causing problems. But note that people have decided to extend sexually transmitted infection to a bacteria that is not even causing any problem. Take note that Staphylococcus aureus is never a sexually transmitted infection. Staphylococcus aureus is a benign bacteria that will only raise its ugly head when your immunity is down. And even when your immunity is down, it will not cause any sexually transmitted infection in you. So now let's quickly demystify some of these sexually transmitted infections, such as gonorrhea. Now, gonorrhea is one of the commonest causes of sexually transmitted infection. It is caused by bacteria, and the symptoms are seen more commonly in male between 3 to 5 days when they are exposed to a lady that is infected with this infection. The symptoms include the burning sensation when urinating. Initially, it starts with itching of the orifices of the penile shaft. The hole in the penis will become itching after sex. Thereafter, you have a burning sensation during urination. Day 3, you start having painful urination increases in intensity. Day 4, day 5, day 6, then you start having pus discharge from the penis. Day 7, you have day 7 to 1 week to day 8 to day 10, you start having bloody discharge. When you pee, after the pee, you see clots of blood coming out from your urethra. Then you are in trouble. You are in serious trouble. It is so shameful that many persons don't like going to the hospital to see a doctor when they are infected with gonorrhea. What they do is they go to a kiosk, a chemist, that will give them a gentamicin injection and ciprofloxacin tablets. Research has shown that gonorrhea infection today is getting resistant. There are lots of resistant gonorrhea infections to these common medications. Take note that your ampiclox, your Bichian ampiclox will not give you cure from your gonorrhea. You have to see a doctor whom will assess you, investigate you, and know the corresponding antibiotics that will be prescribed for you. We have the chlamydia infection too, presents such like gonorrhea too. Most times you cannot differentiate from the symptoms. You only differentiate when you do your sensitivity culture, microscopy culture and sensitivity. That is only when you can differentiate if you are having a chlamydia infection or you are having a gonorrhea infection. That is for the male. For the female, most times these infections are masked. There is no side effect. There is no symptoms at all. It is masked, and most times after some years they start having irregular period. They would think they are getting age. They don't know that their endometrium is infected. They don't know that their pelvic organs are becoming infected. They don't know that the tubes, the fallopian tubes are infected. The ampulla region is infected and inflated, and hence it will result to the first time they now try to get pregnant. If they eventually succeed to get pregnant, they will suffer what is known as ectopic pregnancy. Ectopic pregnancy is just a medical emergency, especially if it is ruptured. The fertilized ovum will implant in the fallopian tube and cause rupture of the fallopian tube, and this woman will be taken to the hospital to do whether a sapingectomy or a sapin. It depends on the severity of the ectopic pregnancy, and most times they lost their fallopian tube. Now, take note that women will not see these symptoms most times. In fact, it can last them for 20 years, 30 years. They will not know until they start trying to get pregnant. Then they will understand that, that means I am infected with a pelvic inflammatory disease, because gonorrhea will come, will stay there, chlamydia will come, will stay there, all sorts of infection will come, they will stay there, and they will become clusters of infection known as what? Pelvic inflammatory diseases. Okay? Same thing chlamydia infection will do, or will cause such damages too. In male, long-term infection will cause urethral stricture and infertility. In female, long-term infection will cause infertility and what? Ectopic pregnancy. Okay, now syphilis. Syphilis is also a dangerous bacterial infection caused by a spiral bacteria infection known as Treponema pallidum. It is usually silent in presentation, both in male and female. Sometimes you will not even know that you are having syphilis. Hence, it is a silent infection. The only symptoms that you will see, but they don't usually take it serious, is a sore, an open sore on the penile shaft, or an open sore on the vaginal orifices, or the labia minora or the labia majora, and they will just take it with levity. It's just one of those things. But no, you are in the primary stage of syphilitic infection. Yes, the primary stage of syphilitic infection. The secondary stage is dangerous. The tertiary stage is quite dangerous, and it affects the brain, and affects other parts of the body, and sometimes causes paralysis too. So it may not have any symptoms, but the person is a carrier of syphilitic infections. It is quite dangerous, and it is something that everybody needs to be wary of. Whenever you see a sore in your penile shaft, or you see a sore on your vaginal entrance, it is something that's cause for a doctor's attention. Okay. Now we have another infection, sexually transmitted infection, such as the herpes simplex virus. Researchers have shown that up to between 290 million persons to 500 million persons are currently carriers of human herpes simplex virus infection. It's quite painful. You have clusters of rashes, not really pustules and rashes, just like the pulses that comes out from chicken pox around the vaginal entrance and on the penile shaft. Very painful, crusted and weeping. crusted and weeping and painful. And the research has also shown that those who have herpes simplex virus and syphilitic infections, they have a very high risk of getting HIV. So these two, anything that will cause open sore in the penis or in the vagina is a risk factor for HIV infection. Now, we have the hepatitis B virus. It is highly infectious, more infectious than even the HIV itself, though it is common amongst sex workers, those drug abuse, and men sleeping with men, such as Bobrisky, because those who do drugs and do anal sex is common amongst them, and those who abuse drugs, they are at high risk of getting hepatitis B virus. One of the commonest causes of infection, liver cancer, is what? Hepatitis B and hepatitis C. I will not dwell so much on hepatitis B or hepatitis C. If you have the knowledge of hepatitis B, just know that same knowledge applies to hepatitis C. Now, it is now left for you to take it serious or not. It's not left for you to protect yourself. Either you decide to do what others are doing by doing unprotected sex, or doing what others, people who are wise, are doing protected sex. But there is one that is left, known as what? WATS, the human papilloma virus. The human papilloma virus, the HPV, causes WATS. It is sexually transmitted infection, and it is the cause of cervical cancer. So any woman who is sexually active, it is advisable for her to do screening for what? Cervical cancer. Take note that condoms do not stop the infection from from human papilloma viruses. So abstinence is the protection from human papilloma viruses. So we'll see you next time. Thank you for listening, and have a wonderful afternoon.